On July 25th, the U.S. Department of Health and Human Services announced a proposed rule to strengthen non-discrimination in healthcare. It's a rule that actually implements Section 1557 of the Affordable Care Act. That's the section of the Affordable Care Act that prohibits discrimination on the basis of race, color, national origin, sex, age, and disability in certain health programs and activities. The feds say this proposed rule actually restores and strengthens civil rights protections for patients and consumers in certain federally funded health programs. Restores because you may recall the 2020 version of the rule limited its scope and power to cover fewer programs and fewer services. In a statement, the U.S. Department of Health and Human Services Secretary Becerra says this proposed rule ensures that people nationwide can access health care free from discrimination. And he continues, standing with communities in need is critical, particularly given increased attacks on women, trans youth, and health care providers. And he concludes, health care should be a right not dependent on looks, location, love, language, or the type of care somebody needs. And the rule does a lot of things. Here's just a quick summary. It reinstates the scope of Section 1557 to cover the U.S. Department of Health and Human Services health programs and activities. It clarifies that Section 1557 non-discrimination requirements apply to health insurance issuers that receive federal financial assistance. It aligns regulatory requirements with federal court opinions to prohibit discrimination on the basis of sex, including sexual orientation and gender identity. It interprets Medicare Part B as federal financial assistance. It refines and strengthens the process for raising conscience and religious freedom objections, and much more. You can read the proposed rule. We link to it in the description below, along with instructions on how to submit a public comment.